Namaste. My name is Dr. Ramya Uppuluri. I am a consultant at Apollo Cancer Center, Chennai, in the Department of Pediatric, Haematology, Oncology, Blood and Marrow Transplantation. I am here today to talk to all of you about blood cancers in children. We all know that in this day and age, childhood cancer is curable, and the most common childhood cancer is leukemia. Acute lymphoblastic leukemia is the most common childhood cancer, which is basically a type of blood cancer. So what happens in blood cancer is this. We all have bone. Inside the bone we have bone marrow, inside of which we have stem cells. All blood in the body is formed from stem cells. So you have red cells, white cells and platelets. Red cells are important for hemoglobin. Platelets are important for clotting in our body. White cells are several types. There are neutrophils, lymphocytes, monocytes, eosinophils and basophils. Neutrophils are like the policeman in the body. They are important to fight infections. Lymphocytes are again important to fight infections, and there are types of lymphocytes called T cells and B cells. Normally, all of these cells in our body, they will form and they will die. They'll form and die. That's a normal procedure for all of us, and that's the normal process that happens in blood formation. But sometimes we don't know the reason why, but there are some changes which happen within the stem cells and in the lymphocytes, whereby the lymphocytes will go on forming and form bad cells which are called lymphoblasts. And these lymphoblasts, when they accumulate within the body, that is called acute lymphoblastic leukemia. Now, children with acute lymphoblastic leukemia can present in any way. Some of them may have no symptoms at all, but most of them come with symptoms like fever, which may be of a prolonged duration, a lot of body pain, bone pain. They may have sometimes swelling in the neck, which means the lymph glands which can get swollen. They may come with a big abdomen because of the liver and spleen which have gotten swollen, or they may come sometimes with symptoms of bleeding because the platelets go down in the body, so they may have bleeding symptoms on the skin or sometimes from the nose or the mouth. So they can present in various ways. For diagnosing leukemia, of course, we do a complete blood count, we do a CBC and a peripheral smear. In the CBC, we look at the amount of red blood cells, the hemoglobin, the white blood cells, the type of white blood cells in the body. We look at the platelets, the amount and the distribution. Then we go ahead and do a bone marrow aspiration in the child. Bone marrow aspiration again is not like an operation. You give the child some medicine to sleep. When they are sleeping, so that they don't have any pain, we take 1 drop of blood from the hip bone, where you get those bone marrow cells, and you examine them. In the bone marrow aspirate, you look at the smear, where you look at what kind of bad cells are there. And once in that you know that the child does have bad cells, which are the blasts that I was talking about, you do a test flow called flow cytometry, which tells you exactly which type of leukemia the child has. From the bone marrow samples, we also do certain other tests called cytogenetics, which means you look at what type of mutations, what type of changes within the chromosomes in these leukemic cells are present. All this is now very, very important for something called risk stratification. Risk stratification is the key to getting good outcomes in children with cancers. With all these tests, you classify children as what kind of risk they come into, and based on the risk that they are in, you give the appropriate kind of treatment and chemotherapy. Now, treatment for leukemia includes mainly chemotherapy, which is basically just a bunch of medicines which are given either through injection or tablets. So chemotherapy drugs are usually given for about 4 weeks in a scheduled pattern through international guidelines. And at the end of 4 weeks, you do another bone marrow test and you look for something called measurable residual disease, which is done through a machine, whereby you look at even those bad cells which may have been left behind in the bone marrow, which cannot be picked up by the naked eye. And this is an extremely important test called MRD. So you've done 4 weeks of chemotherapy, you do MRD at the end of 4 weeks, and then you plan further after that. All the chemotherapy medicines that we give children do have certain side effects, which are all temporary side effects. They may get vomiting, they may feel nauseous, they may not eat adequately, they may feel tired, they may have stomach pain, fever, and there will definitely be hair fall as well. But all of these are temporary side effects, and once you stop the drug, the child gets better. And all of the hair will come back, all of these side effects will settle. Usually for ALL or leukemia, there is no stage, because we know that the blood is all over the body. So very often parents will ask us, what is the stage that the child has come into? So there is no stage for leukemia because it's blood cancer and blood is all over the body, and therefore there is no stage. And all children are given treatment based on the parameters that I told you, whereby we risk stratify them. In ALLs, the treatment after giving the 4 weeks may be for another 4-5 months of slightly intense chemotherapy, followed by about 2 or 3 years of maintenance chemotherapy. The other 2 types of leukemia that I want to touch upon is AML, which is acute myeloid leukemia, which is basically leukemia which arises from the neutrophils, not like lymphocytes. Lymphocytes, anything will cause ALL, while if it has to do with neutrophils, they get AML. Now, AML is slightly different in the treatment, that you need to hit them hard and fast. So you give intense chemotherapy for about 4 months, and usually at the end of it, if they are well, we don't give any further treatment. CML, on the other hand, is chronic myeloid leukemia. In CMLs, the treatment is very different as compared to what I just spoke about. CML, there is something called a magic bullet or targeted therapy. So in the CML, on the leukemic cells of CML, you have certain kind of proteins and certain expression of a protein called tyrosine kinase, which comes from a specific translocation called translocation 922, or it's called the Philadelphia chromosome, because it was discovered first in Philadelphia. So there is a specific targeted therapy or a specific tablet which targets this specific protein called imatinib or dasatinib, and these are the drugs which we start these children on, and they will be on imatinib for a prolonged period of time. It's like taking medicines for diabetes and hypertension, that's all. So they will have to be on this one pill for a long time. They can go to school normally, they can go to college normally, etc. on this tablet. So that is CML. Now the main question is, will my child live normally after all of this, after all this thing that has happened? How will the quality of life be? Today in this day and age, with the excellent supportive care that's available, with the excellent facilities that are available and the treatments that are available, more than 90% of children with leukemia are curable. In these children who live in the group that are more than 90%, where they live normally, they can go to school normally, they can go to college normally, they can get married, have a normal life. Of course, after completion of treatment, we do need to keep them on follow-up for late effects, which mainly include how well are they growing, how well have they attained puberty. We need to check echo regularly for their heart functions. We need to do thyroid function tests regularly. But otherwise, these children do live normally and they can go and do activities like the rest of us. 90% of children can live normally after completion of treatment. Thank you.